Good morning, everyone, and welcome to the first morning meeting with Groundwork Ohio of 2025. We're super excited to be back. We've already been at the State House this week. They just started their new General Assembly on Monday, and we've already been over there a couple times. So the new year is definitely kicking off in full stride. Thanks for joining us. We are so thrilled today to welcome our friend Sara Hudacek. Sara is the Coalition Manager of for Ohio's Future, which is a nonpartisan, nonprofit coalition of state and local health and human service policy folks. And Groundwork has been a member for a long time and loves the work that Sara does. AOF's membership covers a broad range of policy areas, and I think most of them impact the lives of young children. So I think our folks on the call today will really benefit from learning about Sara's work. Some of these areas include hunger, healthcare, obviously childcare, education, safety net benefits, child welfare, workforce, and aging, Ohioans with disabilities, and even much more than that. Sara also supports the newly formed Economic Mobility Alliance. EMAO is what we call it. That's what it's listed as on my calendar. And we might have a couple folks dial in today who are on that work group too. But the EMAO is an alliance of state and local advocacy, research, workforce development, and other HHS orgs and funders committed to ending systems of disincentives to work, which a lot of us refer to as the benefits cliff. We're all familiar with that in our work. So you can check out Sara's websites. I'll go ahead and put those in the chat as we get started. But because we keep these meetings brief, I don't want to talk anymore. I want to be able to toss it right over to Sara. So hopefully you've got the share screen button, Sara, and can go ahead and join. And I'll kick it over to you.
Great. Thank you so much, Brittany, and thanks for the opportunity to join and be able to talk about all of Advocates for Ohio's Future's work. I'm really excited to be with you this first full week of 2025. So Brittany gave a great overview of who Advocates for Ohio's Future is. This is our long kind of descriptive mission statement, and really AOF exists to bring together organizations that span the whole spectrum of health and human services, because we know that Ohioans don't live their lives in silos. So we want to approach advocacy at the state house and in state government from a holistic perspective and make sure that we're advocating for investments and policies that are all across the health and human services spectrum and not kind of one area of health and human services over another. So to give you an idea of who is at our table, this is our quick snapshot of our leadership team. Our co-chairs are Susan Jagers and Charlotte Rudolph, and then we have 6 other executive committee members, and then a larger steering committee that, of course, includes Groundwork Ohio. And it really is kind of alphabet soup of acronyms and a lot of organizations that I'm sure so many of you are familiar with, or I think I even saw some of you who are AOF members on the call. So the steering committee, the executive committee, is really the core of AOF and drive the strategic work and strategic direction. And with such varied members that we have at our table, we also have quite a few varying budget priorities and things that we're watching for this upcoming budget cycle that are sorted into kind of 4 buckets. The first bucket is focused on kids and supporting child health and healthy futures for Ohio's kids, which we will always remind legislators. Kids are the workforce of tomorrow. They're going to, investments now are really going to pay off. You're going to see that in 20 years. So we want to make sure that we're prioritizing kids now. And some of those priorities that fall under this bucket of kids include investing in maternal and infant health, funding, and also supporting evidence-based programs. The second one here, WIC benefit loading. I know that the Ohio Association of Food Banks presented just a couple months ago and included a really great presentation on the importance of modernizing WIC, including moving benefit loading online. So I won't touch on that, but Healthy Beginnings at Home is one of the programs that we're advocating increased investment for. It's a pilot pilot program to provide housing for pregnant women, and is building up an evidentiary base to eventually be able to advocate for state reimbursement for housing for pregnant women. So we want to increase the funding for Healthy Beginnings at Home to really make sure that that pilot can continue. We are always advocating for Medicaid for families and for kids. We're paying particularly close attention this budget on the continuous coverage piece of this. In the last budget, there was a provision included in the language of the budget for continuous coverage for kids through their first 4 years of life, but Medicaid didn't have the funding that they needed in order to implement that provision. So this budget, what we're watching for is for that funding for those first 4 years to be included. And then down the line, we'll really return and advocate for continuing that coverage through 6 years of life, and then increasing coverage for families up to 300% of the federal poverty level. So for this budget, we're really focused on the funding for those first 4 years. Of course, lead poisoning throughout Ohio, we need additional investments in prevention, in remediation, and comprehensive health screenings for kids in their communities, kind of meaning where families are. And then universal healthy school meals for kids. Advocates were able to achieve kind of part way a really great success in the last budget to cover the reduced price category of school meals. So there's kind of the free category and then the reduced price category that's at a higher eligibility threshold. Now in Ohio, as of the last budget, any child in a family that's 185% of the federal poverty level or lower receives free school meals. There are still a lot of kids, though, who are not able to access the free school meal program or face barriers to that program. So making school meals free for all students can really remove stigma, remove those barriers, and make sure that all kids are able to access those meals. Our second big kind of bucket or category of budget priorities focuses on work supports, economic mobility, and, like Brittany mentioned, benefits cliffs. So many of Health and Human Services programs are work supports. Ohioans can't work and be healthy members of the workforce if you don't have access to food, stable housing, transportation, and access to Medicaid and doctor's appointments and prescriptions that you need, for example. So everything ties into work. So we're just drawing those connections more explicitly when we're talking about some of these supports. And then also for benefits cliffs, like Brittany said, we're all familiar with this term. We've heard it a lot, where families who are receiving public benefits and might be presented with a promotion that comes with a wage increase find that that wage increase results in a decrease in public benefits that ends up with less in their household budget at the end of the day. So that's a really hard cliff to get over. Impossible if you don't have some kind of support. We can make some public policy investments to change that. And some of the ways that we can start to address economic mobility and security are by making the state earned income tax credit refundable. Right now, we have a non-refundable credit. We're one of only a few states in the country that has a state earned income tax credit, but makes it non-refundable, which just means that after tax liability, families don't get the rest of that credit in a check that is sent to them with their tax refund. There is a lot of support for this at the State House, like particularly among Senator Lewis Blessing, who has been a very vocal proponent of making the state earned income tax credit refundable and has a plan for how to pay for it as well. And was talking about this, I mean, just even as recently as December. So we'll be watching very closely to see what the senator is proposing for the budget and supporting that. We also want to make sure that county departments of job and family services, who are helping families navigate so many of these public programs, have the resources and funding that they need in order to staff their agencies and really focus on transformational casework. County departments of job and family services have been underfunded for so many years and are really kind of struggling with transactional paperwork and want to move to transformational casework, but need significant investments from the state. We're also supportive of expanding initial publicly funded childcare eligibility to 200% of the federal poverty level. It's currently at 145%. We got a 3% bump in the last budget, which is not enough. It went from 142 up to 145. So we're continuing to advocate for increased access. In the governor's State of the State speech last year, he did introduce the Child Care Choice Voucher Program that I'm sure you're all familiar with, that grants access to childcare for families who are between 145% and 200% of the federal poverty level. And from just a quick review of the Department of Children and Youth's budget request that they sent to the Department of Management and Budget, or Budget and Management, OBM, it looks like that is proposed to be included in the next budget. So we'll have to see what the governor decides to include in his executive budget request. And then, as always, Advocates for Ohio's Future will always be advocating to protect strong public benefits and safety net programs. Like I've been talking about, Ohioans need access to all of these supports across their lifespan so that they can live healthy lives. And we have seen in the past in recent budgets where public benefits have been a contentious point in the budget, and we want to make sure that we're not just advocating for increasing investments in so many of these programs, but also protecting the strong public benefits and safety net programs that we already have. So we'll be focusing a lot on that as well in this budget. And then the third bucket category of our budget priorities is really focused on older adults and adults through the end of their lifespan. And this includes a number of supports for Ohioans to be able to age in place and where they choose, like creating a state-funded minimum benefit for the SNAP program to bring older adults without earned income up to $50 per month. Right now, the federal minimum is $23 per month, which doesn't go very far with today's grocery prices. $50 still isn't enough, but it is a substantial step up from $23. So we join our partners in advocating for that. We're also advocating to increase the adult protective services line item and increasing the senior community services programs line item, which is used for non-Medicaid services. That includes things like meals, transportation. It can include home modification and housing assistance. And that really ties into the last bullet there about home modification and really addressing homelessness and housing insecurity among older adults. And then this final category, I only want to touch on for a brief moment because I could talk for so long about all of these. AOF really lifts up the priorities of our members and wants to support what our members are prioritizing the most. And so this is just a sampling of what Advocates for Ohio's Future members are advocating for and have been advocating for, maybe even in the past budget, and are continuing to ask for in this budget. So we'll be watching these and seeing where they fall with the governor's executive budget that's going to come out in less than a month. And I want to turn now to introduce Economic Mobility Alliance Ohio. This is a new collaborative and a new alliance that launched just last August. And really, we are a group of different organizations, health and human service, research, workforce development, and funding organizations from across the state who have been working on benefits cliffs and economic mobility issues in our communities for a number of years, and really just aligning those efforts and coming to the State House to share that this is a statewide issue that communities across the state are facing, and that really this needs to have a state solution because we're talking about benefits cliffs are enshrined in public programs that are statewide. And so you really can't have a piecemeal patchwork county by county solution. We really want to address it from a state level. So that's the impetus behind Economic Mobility Alliance forming. And I want to show you this quick graph that I borrowed from the Center for Community Solutions. This is doesn't have labels. It's really more of a mock-up of what a family might face when they are moving from a minimum wage role all the way up to what I'm sure many of us would consider a really stable wage position. And, $30 per hour, you're still facing cliffs as you're navigating public benefits. So what this mock-up shows you is that it's not just one cliff that families are facing that they have to kind of bridge as families are moving towards economic stability and economic mobility. There are multiple benefits programs that have cliffs that families face, and there's multiple cliffs in each program that families navigate as they move through the sort of salary and wage continuum. So this is really what we're trying to solve. Some of these cliffs are really big, and it's impossible to face them alone without external support. These cliffs are the result of intentional public benefits policymaking, so they can also be undone with public benefits policymaking. The leadership of Economic Mobility Alliance Ohio is made up of all of the organizations that you see here. These are all founding members of Economic Mobility Alliance. And then we have other organizations that are part of the work group, like Groundwork and some others that Brittany mentioned. And really our priorities, we have three big ones for this budget process, which is to first make Ohio's earned income tax credit refundable and increase publicly funded childcare eligibility to 200% of the federal poverty level. So those are similar to Advocates for Ohio's future priorities. And then Ohio also has two current benefit cliff pilot programs. The first one is the Benefit Bridge pilot program that is administered by County Department of Job and Family Services agencies. It's still in pilot phase. It's in a dozen counties across the state, and it is for Ohioans who are facing cliffs to enter the program and receive things like career coaching, financial literacy training, financial empowerment, and as they move through the program, receive financial incentives that are meant to bridge the cliffs that are faced across kind of the wage continuum. And then there's also a Benefit Bridge employer pilot that was included in the last budget that gives funding to employers to help their employees navigate benefits cliffs. And from a quick scan of the Department of Job and Family Services budget request that was sent to OBM, it looks like they are advocating to continue the first benefit benefit bridge pilot program, the one that's administered by county departments of job and family services, and not the employer program. The county pilot program has seen some really strong initial results, so we're really hopeful about that. We want to continue to improve and expand the pilot programs, and then also we want to see increased reporting and transparency on outcomes. And are there already things that can be expanded statewide, that can be expanded even to more counties than just the 12 counties, because there have been some strong initial results. And to talk about all of this and to continue to inform legislators about benefits cliffs and how families are currently facing them and the challenges that they present, we are having an advocacy day on Wednesday, March 19th. We are not yet, we don't have a registration link just yet, or very much additional information. It will come very soon. Hopefully we'll have some of that out in the next 2 weeks. And I want to include some information for staying in touch. Advocates for Ohio's Future has a regular newsletter, and Economic Mobility Alliance is going to be launching a new newsletter that you can sign up for on our website. And then I wanted to include this budget tracker graphic that I'm really fond of, that I made, that really shows everything that is yet to come. What is not included on this graphic is everything that happened last year, like the cabinet departments, talking to community stakeholders and advocates, and creating their budget proposals that were submitted to OBM and to the governor's office in October, and everything that has happened since October, like the governor's office reviewing all of those and starting to formulate the executive budget proposal. So this is really kind of the start of what happens in the legislature, is what you're going to see here on this tracker. And I also lovingly refer to it as the pizza tracker. So where we are now, you're still looking at the menu. No order has been placed. Your pizza is not in the oven yet. And it is going to take 6 months to make this pizza. So Governor DeWine right now is still looking at the menu. He's still evaluating all of the cabinet requests that have come from the cabinet departments, and is formulating the executive budget proposal. And the next step that we'll see that will really kick off this whole tracker process is when the executive budget is released on February 3rd. And that's when the House hearings will begin. And then really we won't see a lot of other movement in terms of like even the omnibus and the floor vote. That will probably wait until around Easter. So there's a lot of time left. So hopefully it's not daunting how much is left. Hopefully it's a little more hopeful that there is still a lot of time left to make change and to advocate at the State House. So with that, I know I covered a lot, so I will say thank you so much to Brittany and to Groundwork for letting me share everything that we have been up to. And please feel free to email me at any time if I can be helpful, and I would love to answer any questions.
Thank you so much, Sarah. I know it was a lot of policy content over a short amount of time, but I feel like this was the perfect way for us to kick off the year because your work is so reflective of the broader HHS space, and it gives us such a context for what we're doing in the child care and early learning and maternal and young child health space. So thank you for your leadership and for being such a critical convener at the State House for the HHS focused folks. I would love to ask if there are questions. We had a comment in the chat. Someone from the Cincinnati area is looking for ways to address SEOH, and they think it would be a great connection with our work, specifically the benefits cliff policy work that you're working on, Sarah. So, Elise, yeah, I did note on the leadership of the Economic Mobility Alliance team is the Women's Fund of Cincinnati. So it sounds like there's some great Cincinnati representation in that group. And I'm not sure, Sarah, if you're putting out a call for more folks for the State House Day on March 19th, if you would like folks to get in touch with you via email if they're interested in attending, or if you're keeping it. I'm sorry if I missed the kind of scope of that day.
No, yeah, absolutely. I would love it. Please email me. I would love if you're able to come to the March 19th day. And also if you're interested in joining the work group meetings for Economic Mobility Alliance, send me an email and I will add you to those groups. So please do. I will add my email quick in the chat because I know it's so much easier to copy
Thank
and
you.
paste that way.
I know. We appreciate it. And it looks like this caller like we're on the phone like it's 1993. But this participant would like to join the State House Day. So that's great. I'm so glad to make the connection.
Amazing.
Wonderful. We have a few more minutes if anybody wants to hop off chat or put another question in the chat for Sarah.
There's a question about what are the work groups that
Oh,
are public
perfect.
to join. Yeah, that's a great question. We have the Economic Mobility Alliance work group. We have a nutrition work group that focuses on nutrition, hunger, food insecurity, including things like WIC, that is led by the Ohio Association of Food Banks and the Hunger Network in Ohio. That is public to join. And in terms of the other work groups, I'm working on getting some other ones up and running. So I will have more information on those additional work groups because we are missing some issues there in that work group coverage. So thanks so much for that question. Email me if you have any questions or if you just want to say that you're interested in joining some additional conversations later. And then when I get those started around the budget process, then I would love to add you.
And Sarah, anybody can
Thank
join the
you.
newsletter list, right? That's not just for members. So if they go to the newsletter page on your website, they can get updates as those work groups form in real time and stay connected.
Absolutely, yes.
Awesome.
Anyone can join the newsletter. My email, my door is completely open. Please email me. If Advocates for Ohio's Future doesn't have a work group, maybe another organization that's at our table does have a work group that's focusing on something that you're interested in. So I can also help connect you that way. I see a question about if a project, there's an image, if that is one of the benefit bridge projects. I do not believe that is. So the benefit bridge projects that I'm referencing are all within Ohio. This looks like a regional multi-state project. I'm not familiar with the bridge project. It looks like an Appalachian project, so it might be federally driven or at least regionally driven. Brittany, it sounds like you might.
Yeah. Yeah, it's cash assistance for pregnant moms. And it is regionally specific and multi-state. So I think it's separate from what Sarah's talking about, but I do think that this cash influx into a household could help overcome some of the barriers of the benefits cliff work that Sarah's talking about.
Thank
Great
you.
question.
Yeah.
Anyone else in the last few minutes here? Home county. Okay, awesome. Thanks, Sherry. We appreciate that. Well, we are so grateful to have Sarah. I love working with you. I know our team participates in a lot of the different work groups, and your convenings just as a member are so worthwhile to us to get to hear about what folks are working on across this space. And you're just such a great wealth of knowledge and connectivity. So thank you for your leadership on the square and across the state. And I highly encourage everyone to sign up for the newsletter if you haven't yet. It is a wonderful resource, the events, the news content. It's very statewide. It's not just Columbus based. So I can't recommend it enough as a great resource as you're navigating the state budget season. Any other calls to action or anything else you'd like to plug with us, Sarah, before we depart?
No, gosh, it's kind of the quiet before the storm, right? Like we're all kind of trying to get as ready as we can before the budget kicks off. So there will be calls to action that are coming out. Please join the newsletter. I guess, since you asked, there is currently today, there's a hearing on a proposal to add work requirements to the Medicaid program in Ohio for the expansion population, who are typically childless adults who are between 18 and 55, who don't have any underlying conditions, chronic conditions, disabilities, or mental or behavioral health challenges. So generally not families would be impacted by the work requirement specifically, but as we know, health throughout the lifespan is important, especially health before people become parents. It's kind of becomes an endless cycle of trying to catch up, and if you're not able to access healthcare when you need it. So AOF will be launching a sign-on letter later this week or early next week. So please keep an eye out for that, for more information on the Medicaid work requirements piece. So I am glad that you asked that, Brittany,
Yeah, I'm glad
because
you remembered that. Yeah, that's a great call out, and we'll be sure to share that with our team and our network as well.
and so much credit also to, I have to say, Brittany and her team and Caitlin for suggesting a sign-on letter, and always keeping the coalition on our toes. I think it was such a great suggestion. So thank you.
Well, yeah, happy to. And it was generated from an infant mortality collective in one of the localities. So it's all important for us to all stay connected and keep doing these calls and keep doing these meetings throughout the budget cycle and the onset of the new federal administration. So thanks, Sarah. Wonderful. We're a minute before 10. So I'm going to go ahead and close out the meeting. We'll be back next week as usual, speaker TBD, on the 16th from 9:30 to 10. And then on the 23rd, we'll have Julie Stone with the Ohio Association of Head Start. So thank you, Sarah, so much. I look forward to working with you this budget season, and I hope everyone has a wonderful Thursday. Take care.
Thank you.